This is the Mountain and Prairie Podcast. I'm Ed Robertson. My guest today is George Hodgin. George is a former Navy SEAL turned entrepreneur who's revolutionizing the world of medical cannabis research. George is the founder and CEO of BRC, also known as Biopharmaceutical Research Company, one of the only federally legal cannabis research organizations in the United States. His company's leading the charge in developing safe, regulated, and scientifically backed cannabis-based therapeutics, offering alternatives to opioids and other pharmaceutical treatments. This is George's second time on the podcast. Our first conversation was almost exactly 5 years ago, back when his company was in its early stages. The pandemic was just beginning, and he was navigating the uncharted waters of federal cannabis regulations. Since we last spoke, BRC has made huge strides, partnering with leading medical institutions, earning FDA orphan drug designation, and paving the way for legal cannabis-based medications. If you haven't already, I highly recommend going back and listening to that first episode, where George shares the full story of his fascinating career trajectory, his time in the Navy SEALs, his MBA at Stanford, and his undergraduate experience as a Morehead Cain Scholar at the University of North Carolina. That conversation is a great companion to this one and provides even more insight into his unique journey. But in this episode, George and I dive into the evolution of BRC, the shifting cultural and political landscape around cannabis, and what it's like balancing an entrepreneurial mindset with the slow, methodical world of federal drug approval. We also talk about leadership, risk assessment in business and combat, humility versus arrogance, and what it's been like to watch his wife, best-selling author and culinary powerhouse Caroline Chambers, build an incredible career of her own. Be sure to check out the episode notes for a full list of everything we discussed, plus links to resources, books, and more. George is one of the most insightful, driven, and humble people I know, and I always learn a ton from our conversations. Whether you're interested in business, science, leadership, or just a great story of perseverance and innovation, then you'll love this episode. Hope you enjoy. George, you're the man. I'm so glad to be chatting with you again. When I was getting ready for this thing, I realized it was almost exactly 5 years ago when we talked, which is crazy. I mean, you had one kid then, and the pandemic was in like week one, and we were both trying to figure out what was going on. And I would encourage people to go back and listen to that episode because it gives so much great info about your background and all your different experiences. But I thought we were long overdue for a catch up. And so, first of all, thanks for taking the time. Second of all, for folks who have not listened to that episode, could you just kind of give a brief overview of your company? Just kind of the thumbnail sketch, I guess, as they say in business school, the elevator pitch. But talk about what y'all do, how you do it, and how long you've been doing all that stuff.
Yeah, Ed, well, thank you so much for having me back on. I cannot even fathom that 5 years has passed. It feels like I'm not even 40, but it feels like it's been 50 years or 50 minutes because it just feels like yesterday. But it's such a joy to be back on with you. And even like thinking about the fact that I had one kid 5 years ago and now we have three little boys under 6 is like mind blowing to me. So we've been busy, my wife and I, but nonetheless, so I'll give you a quick snapshot, like you said, on our company. So after my service in the Navy SEAL teams and then getting a graduate degree at Stanford, I started BRC, Biopharmaceutical Research Company, and we're effectively one of, if not the only, federally legal operational cannabis businesses in the United States. What that means for us is we develop drugs through federally legal pathways, meaning the DEA, the Drug Enforcement Administration, or the Narcotics Agency, and the FDA, the Food and Drug Administration, under their blessing and through their frameworks to create what we believe are drugs that are potentially safer than alternatives to what's on the market, opioids and the like, to help people that otherwise don't have anywhere to look for help. So we've made a number of really exciting announcements of late that the FDA granted us orphan designation, which we can talk about what all these things sort of mean. But by and large, what it all means is that Americans deserve access to regulated, safe, characterized cannabis-based therapeutics, as opposed to having to choose from things like opioids. And so in our estimation, the way to do that effectively and truthfully is to run everything through the federal regulatory pathways. And so that's what our team does. And I'm really proud to be a part of our team and hopefully bring some innovative medicines to patients that need it.
It's crazy, again, thinking about 5 years and how much, at least from my perspective, has changed as far as the overall thoughts and acceptance of cannabis, and then how really kind of anti-opioid everyone has become and woken up to exactly what was going on in that industry. And so I definitely want to talk more about kind of the cultural shifts and how that's affected your business. But I was thinking to start out, maybe I was looking at all the success you guys have had, and especially in the last maybe 6 months or so. And there was a really cool kind of a victory you guys had, or that I think demonstrates what you do. And it was your partnership with the City of Hope for breast cancer work. And I was wondering if it just kind of as a case study, so people can get an understanding of really what you are doing. Could you walk us through that? Because that just seems like everybody can relate to what you were doing there.
Yeah, my pleasure. And that is, so we're so excited and proud to have partnered up and collaborated with City of Hope on this project. So City of Hope is a world-renowned leading cancer research center located in Los Angeles, or really Southern California, but has since sort of gone nationwide. And we're just proud to be affiliated with them. And what we do and what we're doing with them is there's this really terrible, nasty illness, and it rolls off the tongue, but it's aromatase inhibitor induced arthralgia, or as we call it, AIIA. And AIIA is a disease or indication which impacts postmenopausal breast cancer survivors. So unsurprisingly, almost exclusively or predominantly women. And it's a really awful condition for a number of reasons. But what it basically is these women, they survive breast cancer. They survive their treatment. They feel as if they have this new lease on life because they've successfully navigated potentially the biggest horror and scare of their life. And then a large percentage of them go on drugs for the next 5 years, 10 years, called aromatase inhibitors. And those inhibit things in your body that will potentially increase the likelihood that their cancer returns. However, one of the side effects of those drugs is that the aromatase inhibitors cause a really nasty pain and arthralgia. And so it's terrible because these women they think they've made it. They've got this new lease on life. They can sort of live their life as they wanted to. And they say, but you've got to take these drugs, for the next 5 years, 10 years. And it turns out those drugs have such nasty side effects that they can't live the life they wanted. So they've made it through their cancer. They think they're home free. Yep. They've got to take this drug, and it just makes them feel terrible, like shit, all day, every day. Can hardly move. Sometimes can't get out of bed. Almost like a really nasty arthritis. And so we think, we have partnered with City of Hope because they have such a great cancer program that we announced with them publicly to study one of our assets in therapeutics for aromatase inhibitor-induced arthralgia. And so that's a wonderful example for us of how we can use cannabis-based drugs entirely legally. So under what they call an IND, an investigational new drug, where we partner with a researcher or investigator, as they're called, and that investigator runs a clinical trial to examine are these products, these cannabis-based products, and for us, these are sort of proprietary mixtures of cannabinoids. Are they safe? And then ultimately, are they effective? And where, ultimately in our long-term vision for the business is, as it stands today, cannabis is not prescribed by a doctor. It's not picked up at a CVS or Walgreens, and it's not paid for by insurance. And we hope that our products and our business will change that, and that our products will be approved by FDA one day, should they go through the appropriate regulatory constraints, paid for by your insurance and picked up at a trusted CVS, Walgreens, whatever that may be, wherever your pharmacy is.
Two follow-up questions on that. How long did that process? Well, first question would be, how did you even identify that as an opportunity? Because there are a million different ways that a human being can be in pain. And so of all the different things, I know you're working on a lot of things, but how did this idea come into your vision enough that you thought, all right, this is something my team and I can devote our resources to, versus all the other ideas that come your way?
Yeah, wonderful question. The way we think about partnerships and the way we think about prioritizing indications that diseases, illnesses, sicknesses that we can attack and hopefully create either cures or treatments for is, and every business drug development company has sort of a different approach to this based on what they want to do. For us, it's, do we think that cannabis could be effective and safe? And is it an unmet medical need? Meaning these people have no other choice or no other place to look for treatment, no other medicine that is labeled or indicated for said disease. So for us, that was really important, that if we're going to do something new and innovative, we can do it in a way that help a group of patients that otherwise don't have an answer or otherwise don't have a treatment. Like I have, if we take insomnia as an example, I have family members that have insomnia. God knows there's been times when I couldn't sleep well. And so I'm not in any way putting down or being pejorative towards patients with insomnia at all. But there are a number of treatments out there. There's a number of medicines and protocols, et cetera, that your doctor can try. I'm not saying they all work by any means. But for the most of the diseases or indications that we select, there isn't anything out there on the market. If we had all the time in the world and limitless resources, would we do other things where there is, potentially a big patient population we could help, but maybe they already have something else that works. We just think ours is safer or better. Yes, I would love to do all of those things, but for us, limited time, limited resources. So we want to try and help the most people that otherwise don't have any other way to help them. So that's one of the ways we do it. And then we've got a whole sort of scientific process behind it, in terms of like, do we understand the modality and the mechanism? And like, I am not a scientist by training, would be the first to admit. So we have an awesome team of R&D, business development, legal, et cetera, professionals that run an internal formal process to study these diseases. Like, do we think it could work, based on the way we believe and know cannabis works in the body and behaves in the body, and the way, pick your disease, in this case, AIIA, and the way that AIIA behaves. So we kind of try and match those two things together, if that makes sense.
Yeah, that does make sense. And when you think about the funnel of potential opportunities that you and your team are considering, like, have you noticed like a ratio of the one that makes its way far down the funnel, such as this one, versus the ones that kind of get pushed out for one reason or another?
Oh yeah. I think we started like probably about 6 months or a year after we first talked in 2020, like you were describing. We've sort of evolved and grown up, as a company and as a business, and happy to talk about that if it's of interest.
Yes.
But we started when we really got the whiteboard out, and it was like, no dumb ideas, just throw spaghetti at the wall and see what sticks. Like, let's throw out 200 diseases, as just a way to like get people brainstorming, and then we'll run the scientific process on everything. I think we started with somewhere between 150 and 200. And right now we have 5 different diseases or indications we're pursuing. And a lot of those were not thrown out because of some like scientific rationale. It could have been, a business rationale. Hey, we think cannabis would work great for XYZ, but there's already 15 drugs on the market for that. So those patients, it doesn't make sense to go after one of those diseases. And those patients are pretty well cared for, even though we believe cannabis would work, exceptionally well for one or more of those. So you kind of take the scientific and then meld mesh the business approach together, and that out of that exercise is born like what indications we want to go after and target. And indications, I mean, diseases, illnesses, sicknesses.
Pretty basic question for you. So y'all grow the actual cannabis and then you supply it. And then when and to interrupt me if I'm saying anything incorrect.
No, you're spot on so far.
Okay. And so you're growing it, then you're supplying it, and then you are in partnership with these other organizations that are helping to create the drug. And then are you an owner in the drug? Like, it's got to go through this long pipeline, but say it gets to the point where it is at CVS to be prescribed to people who need it. Are you an owner of that at that point?
So the way you describe the process is exactly right. We cultivate the cannabis, we extract what we want out of it, all federally, legally under our DEA licenses. The technical term is registration, but for all intents and purposes, it's a permit or a license. We extract it, we formulate it, meaning we put it in sort of the final delivery vehicle that we want for that indication or that disease. And then you're exactly right. We ship it out to the research site, at which point the clinician or the PI, the principal investigator, the researcher, if you will, typically an MD or a PhD or an MD PhD, implements the actual clinical trial in collaboration with us. Every economic structure is different depending on a ton of different variables. But to get drugs across the finish line, like you said, to a CVS or Walgreens is a massive undertaking, both just in terms of time and money and effort. And so we're very careful about the way we structure partnerships to make sure it's fair and beneficial for everybody.
Another question, I think, just about your approach to all this. You are obviously a very driven, forward-moving entrepreneur, and I think I would guess the company is. I don't know if you would still consider yourself a startup. I mean, you've been at it now, quite a while, and you've raised a lot of money. But the whole process of what you're doing, it seems just, by its nature and by necessity in a lot of ways, it's a very slow, long grinding process. So how do you balance that energy that you and your team have and the excitement, and you're doing something brand new? How does that balance out with kind of the other side of the equation, which is this slow regulation? We got to be very careful. Every detail has to be very, very, very dialed in. If that question makes any sense, I'd love to know how you think about that balance, because it seems like two completely opposite ends of the spectrum.
Yeah, that is an awesome observation. And you're right. Those things do seem not just opposite ends of the spectrum, but also mutually exclusive.
Yeah.
I mean, we're close enough for sort of the home of Silicon Valley, where, Facebook's, Meta's famous ideology that sort of overtook Silicon Valley was move fast and break things. Mm-hmm. And for us, it's the opposite. We if you had the same analogy in drug development, it would be move fast and hurt people, which obviously no one's going to do, and we're not going to do. So you cannot move fast because it's inappropriate, number one, because you're talking about medicines that are going into people or animals. So you have to be there. Nothing is a certainty, but you have to be pretty darn sure that you've done everything in your power to make something safe and or effective. And so it's really quite hard. I feel it daily. And I'm sure my team does. And so what's challenging for me and remains a challenge, and I have by no means figured this out, and this is internally as a manager and leader, and sort of outward facing as well, if it's interfacing with investors or research partners or academia, is how do we make sure that no one is ever waiting on us for something, mm-hmm. but that we're always moving as fast as the regulatory process allows us to go. And a lot of that is by law. Anytime you tell the FDA something, or ask, just as an example, you ask the FDA something, hey, we're going to change this research protocol, just for example, you have to wait by law 30 days before you do anything. And it could end up being a lot longer, but it's not like you simply tell them or call the 1-800 line and say, hey, we're going to do this. Is that cool? Or you can't just do it like it's a tech project. You have to literally, there's a formal process to notify them or request to make any sort of change. And it takes at least 30 days for you to be able to implement that. So it is really hard. I think what gives me and our team solace is we are big believers in doing things like the right way, but not the fast way. So for us, that means never breaking federal law around cannabinoids. That's the right way. The quickest way to do it would be to just give cannabis to people in the state legal, federally illegal markets, observe what's happening to them, and then try and create a drug around it.
Yep.
Without going through the federally legal pathway. I think I do not have like some sort of moral or business judgment on the state legal, federally legal cannabis companies at all. I think good on them. They're helping people. They're delivering a product people want. There's no judgment from me at all. It's just what we're doing is complementary, not competitive to them.
Sure.
But our team has sort of had to, by necessity, focus on like the right thing, not the fast thing. But that's very, very hard. Like I get just personally like antsy if I'm not doing something, or like if I feel like a project isn't moving fast enough. And so for me as a manager, it's hard to like accept that and set the conditions so that something can move as fast as possible, but also not just be annoying to people, I'm working with by always calling them, asking them for updates or, hey, what's taking so long? Hey, what's taking so long? Like there's part of it is just sort of accepting that in this world of development and research, things just don't move as fast as you want them to. But that's the price to being able to help people in the right way, I suppose.
Sure. I'd love to hear your thoughts on just the cultural acceptance of cannabis and, I mean, even, psychedelic drugs. I think since the last time we talked, they have become much more, they've been decriminalized, at least psilocybin's been decriminalized in places you would never expect that to happen. And I think overall people have accepted that cannabis is there's a lot of promise there. Whereas I don't know if you told me this or if it was a conversation you and my wife had about when you were starting your company and somebody recommended that you don't have cannabis in the title because it'd be a lot harder to raise. Can you tell that story real quick?
Yeah, absolutely. So our name BRC, which stands for Biopharmaceutical Research Company, is intentionally and unsurprisingly very vague and vanilla and frankly boring. And we were first starting, we hadn't raised any money yet. And we're basically just trying to talk to doctors and scientists and physicians about what we're doing. And our name had like canna, I don't even remember what it was. It had canna or cannabis or something. And no one would call me back, return emails. And one of the physicians we work with, and he's a board member, I was sort of venting to him and I'm like, man, what the hell? This is going to be hard. I knew this was going to be hard, but Jesus, nobody will even call me back. And he's like, think about who you're talking to or trying to work with. It's sort of white lab coat, very process driven, very risk averse, very regulatory focused, like not used to sort of, the traditional Silicon Valley names of like Uber, Lyft, Meta, like what do those things even mean? These people are like talking about boring names. He's like, what do we do? I'm like, well, we facilitate biopharmaceutical research. And he's like, that's the most boring thing I've ever heard. Just call it that. And overnight people are like, this is great. Let's talk. So it was a case study for me and like the importance of naming and marketing.
Sure. And so now though, you think that was 8 years ago, I guess, when you were getting started, about approximately. And now, how do things change, vary culturally as far as the acceptance of what you're trying to do?
100% like inverted from where we
really
started.
That much, huh?
No doubt. I mean, they're like, I think politically, scientifically, academically, when we started, they could basically like say, if I said, hey, let's study the effects of cannabis, they could say like, no, or it was acceptable. And it was probably their true opinion to say, absolutely not. I think it's the devil. I think it's terrible. I'm opposed to it. It's an awful gateway drug. And they could just stiff arm you sort of intellectually. I think that has changed very much politically, culturally, front page risk for investors and big corporates, et cetera. And now everyone sort of has to have an opinion on it. And it's not as palatable for whatever reason to say, hey, I think it's terrible. Like the answer is no, I don't want to talk about it. Basically what people will say now, which is a good thing, I believe, is they'll say, look, it's probably not a panacea, but like we should study it and learn more about it. And let's figure out what's good and maximize that. let's figure out the negatives. Because like any substance, I mean, caffeine being a great example, there's negatives to everything, but alcohol, pick your substance. But now with cannabis, they'll say, hey, it's probably not as good or as bad as people think. Let's just study it and maximize the good and minimize the bad. And so that has changed a bunch. And then when we like basically tell them sort of the founding story of our business, or like the original thesis of our company, which is that, consumers can use cannabis, like you were saying, much like psychedelics. Consumers can use cannabis, patients can use cannabis under a state legal, federally illegal regime, but that's very different than an institution, a biotech company, an academic, another government agency, as an example, like being able to actually study it scientifically in a clinical trial on the campus of a university. Like big organizations still have to go through that federal process, which is where we come in. And so that we have seen a market shift since we started. And now people kind of look at us and go like, really? What do you mean there haven't been that many clinical trials? I thought this stuff was everywhere. So it's been a very interesting shift to watch. What I think is very interesting, and really, I don't even have an opinion if it's like good or bad, because I can talk myself out of either one, is despite popular sentiment evolving, regulatory frameworks and legislation have not moved at all, like period, at the federal level. Some would say, and I would agree with them, that that's like really bad for research and the medical community and the scientific community. I think other people that are probably a little bit more jaded or experienced would say like, yeah, it's a pain in the ass if you're in the cannabis world or if you're a patient, but like the federal government is sort of, and I'm not talking about anything since the election because I don't even want to go there, but the federal government is operating as it should, which is like the states are like little mini test labs. The federal government should change very, very slowly because it shouldn't be responsive to change. It should be more like institutional and slow to make sure we get it right. So like the impatient person in me is like, why hasn't the regulations around cannabis changed? The realist, and if I try and like zoom up to another level, the realist in me is like, the federal system's probably working as it should, which is that it takes really long to change. Me personally, I wish it would change on this one issue a lot faster, but like that's just the name of that's like the name of a game of having such a big, complex country, I think.
But if it changed though and became looser with some of these regulations, would that open up more competition for you though? Would that make it easier for folks to come in and compete against your business?
Potentially, but unclear. So there's a number of things, like, I don't know, meaning it's not clear yet how new regulation would be implemented. And the devil on this one is definitely in the details. Sure. So on the surface, I can talk myself, and this is where I just sort of flip the coin and go, I don't know how to predict the future. So we're just going to execute, like we're going to operate and execute to the best of our ability and accomplish our mission, regardless of all the different noise around regulation, this federal regulation, that, tax implications, because those things are unpredictable and everyone has gotten them wrong in their predictions over the past decade. So like we shouldn't even listen to them or waste our energy. I mean, we'll pay attention to them, of course, but like we're not going to spend a lot of time thinking about them because they're out of our control and they're going to change no matter what. So like, let's build the best business with a legal framework, helping the most amount of people possible, and everything else is going to take care of ourselves. Like we shouldn't build a business dependent on a potential regulatory change. In practice, if cannabis, marijuana gets moved to a less restrictive schedule, so just that in the U.S., like brief teach-in case people aren't aware, in the U.S., drugs of potential abuse or danger and their likelihood for addiction are categorized into 5, what they call schedules. Schedule 1 being the most addictive and or dangerous. Schedule 5 being the least restrictive and or dangerous. There's proposals and talks at the federal level to move cannabis from Schedule 1, where it's been for about 50 years, meaning the most restricted, to Schedule 3. Still restricted, but just much less so. the challenge is going to be like, there's going to be a bunch of regulatory intricacies, like how you have to keep your records, how you have to do auditing and inventory processes. And until those really nitty gritty details are released, we're not going to know like how it's going to impact us. They could say, the federal government could say, hey, it's Schedule 3, but like it's a plant. But all of the federal government's frameworks, or the DEA's frameworks for these things, are basically their rule books, their processes. They're built for pills and powders, unsurprisingly, like most medicines. They're not built for a living plant. So it's really hard. It's like square peg, round hole. If the DEA walks in to audit you, and I'm being a little bit hyperbolic here, but like the DEA walks in to audit you and you make opioid pills, they're going to go, how many opioid pills are in your facility today? And you're going to say 10,001. They're going to count them, and there better be 10,001. And if there's more, you got a problem. And if there's less, you got a problem. The DEA walks in and says, how much THC is in your building right now? Because that's the actual controlled substance, THC. You go, I don't know. Like there's 100 plants. Each plant has a different level of THC. Each plant has a different number of buds and flowers. So there's really no way to know definitively. And so the frameworks are not set up for cannabis at all. So there's going to be a bunch of nitty gritty, painful learning curve, which is why we don't know how it's going to impact us until the actual mechanics of the regulations are rolled out.
I mean, it's crazy to me to think, first of all, that marijuana would be Schedule 1 now. I mean, that's just insane. I always think about, like, you take your average, like a SEC college football tailgate. Yes. Everybody's just hammering beers, drunk, throwing up, fighting, the whole deal. And that's completely legal. And then if everybody there had been ingesting marijuana in one way or another, think about how different that scene would be and how much safer it would be.
Totally. Could not agree more.
It's crazy.
Don't quote me on this, but I'm 99.9% sure. Like codeine, like if you get a cough medicine for codeine, that's an example of a Schedule 5. Another Schedule 1 would be heroin, as an example.
Sure.
So I agree with you. Like, is cannabis the same as heroin? Absolutely not. To date, though, the challenge, and I think you're exactly right. Like, if you think of just someone slamming a case of Coors Light on a Saturday, like, that is not going to be pretty, and it's terrible for them. And the chances that they hurt themselves or someone else, like accidentally or on purpose, is pretty high up there. Like they're at least damaging their bodies. Whether or not they're going to physically hurt someone, who knows? But like, we've sort of as a society said, hey, that's okay. It's personal choice. It's individual liberty. Like, as long as they don't get behind the wheel and they're well aware of the risks they're taking, like, that's their choice as a adult. And we haven't done the same with cannabis. Part of that, there's like a whole, you could have books and podcasts on the racial undertones of why that is. There's a bunch of political and regulatory reasons. But suffice it to say, once like that baby was made and it got put in Schedule 1, it was really, really hard to undo, like almost impossible. People are trying to do it now, but damn, is it hard. One of the reasons, and some would argue this was by design. I don't know. I think it gives the federal government a lot more credibility for being intentional than they probably deserve. But one of the reasons that it's so challenging is it becomes a catch-22. Meaning, like, if you're in Schedule 1, you have to show in a trial, show a demonstrable benefit to that drug that's in Schedule 1.
Uh-huh.
In order to do that, it assumes that you can go get it legally to research it from a federally approved source. You cannot go to a dispensary and purchase it. You have to demonstrate a medical value once it's in Schedule 1, and that's how you start the process to get it out of Schedule 1, to get it to Schedule 2 or 3, whatever. Historically, there was basically no way to procure legal cannabis to do those studies. So it was stuck there in a catch-22 forever. Hey, in order to get it out of Schedule 1, you have to go procure it from a federally legal source like BRC, which didn't exist at the time. You have to procure it from a federally legal source, demonstrate a medical benefit. Well, if you can't get it from the legal source, there is no study, which means it's stuck in perpetuity in Schedule 1. And that's all sort of like that house of cards is unraveling relatively quickly, but it just takes a long time and it's a process.
I really when you say all that, it all makes sense, the whole thing, but I had not thought of that. That was really interesting and stuff I feel like I should have known. So anyway, I appreciate that. One more question about your business. When I know in 2022 you raised a bunch of money, like $20 million. And I'm always curious about that funding and the money raising process. I heard a podcast, I think a few years ago, with a venture capitalist, and he had retired. He had this long, successful career, maybe through the 70s up through the early 2000s in Silicon Valley. And he went back through all of his investments and kind of did a postmortem of what he did right, what he missed, just really looking at everything he did and trying to figure out, right, how did I do? And one of the big takeaways he said was that a lot of times he would bet on the idea versus the team. And he said that if he had only bet on the team, like the idea, it has to be a decent idea, but only bet on the people, he would have exponentially increased his returns. So I'm curious, when you're out raising money, meeting with people, presenting, how much of the money that came in was betting on your idea versus betting on the team that you've built there? 'Cause I know it's probably a mix, but does that make much sense?
Yeah, it makes a ton of sense. I think that the majority of to get us going anyways, like I think going forward, it will be a little bit different. But I think to date, the past 5 years, I think most people were like picking the jockey, not the horse. And by jockey, I don't mean me. I mean like our collective team and our experience. Sure. Our management team is awesome, down to all of our technicians and more junior personnel, not junior in terms of importance, but just in terms of work experience. And they'll grow into being fantastic leaders in and of themselves one day. But I think that it really was a bet on our team.
Sure.
And the reason I say that'll change is I think when we started, there were basically like two questions that we had to answer, and they both seemed kind of crazy, like completely crazy. And the first was like, can we convince the federal government to let us grow federally legal marijuana as a business, which had never been done before in the history of the US? And so people were like, wait, you're going to convince the DEA, at the time it was Jeff Sessions, was the attorney general, not Mr. Cannabis friendly guy. It's like, you're going to convince Jeff Sessions and the DEA to let you produce cannabis for research. I was like, yes, we're going to figure out a way. The second thing was, if we do that, can we build like an investable sort of venture backed, meaning can we build $1 billion business out of creating therapeutics that help people out of cannabis? And I think both of those things, if people looked at that in and of itself, they would say like, geez, is this possible? Maybe, maybe not, but like, it's going to be really complex and really hard. So I think the only way, and I don't know, because I don't speak for our investors, obviously, but I think the only way you would believe that is if you believed in my ability to find and recruit awesome talent around us and then let them work, like find the smart people and let them work, like unleash those sled dogs. And so that's I think that was the bet. Going forward, I think you still have to believe in our management team, but it's more about like, now it's like, can we execute? Like, we've shown we can do the crazy things. We've shown we can convince the federal government to let us produce federally legal cannabis. We've shown we can run it through an FDA process and get it in an approved clinical trial with a world-class institution like University of California, San Diego, or City of Hope, or others that we've been public about. So we sort of like proven that. Now it's like, can we actually execute and grow up into a big company that really helps people and creates cannabis-based drugs? To go from like 0 to 1 or A to B, it was like kind of crazy. From A to B or 1 to 2, there is a bit of a playbook. Like there's still a ton that's hard. There's still a bunch of risk, execution risk, but like, now we just need to show that we can develop the drugs in the clinic, and the crazy stuff is behind us. And this is like the fun part, because this is where we really get to see how much we can help patients. But to answer your question, I think people bet on the team. Going forward, they're going to continue to bet on the team, but they're also betting on like the market, the idea, the efficacy of the therapeutics, things like that.
Yeah. That makes sense. One thing that has stuck in my brain ever since our first conversation, and I think about it probably way too much, and I should have gotten you back on here earlier just to answer this one question. And when I was reviewing our first podcast and I heard you say it, and people can go listen, like at the 11-minute mark, you say that you're a very risk averse person. And I remember that called in my head and I was like, I need to come back to that because I don't understand that. Because you think about your career and, they're kind of two big chunks. One was being a Navy SEAL, which I think most people would agree that's pretty risky. And then a running a startup, and not just a startup, but a startup that involves the DEA and cannabis and basically doing something that has never been done before. And so my question is, how do you think about risk? Because I believe you when you say you're a risk averse person, but how do you evaluate risk, and how do you think about mitigating it? Whether you're talking about, elite military operations, or whether you're talking about doing something that's never been done before in business, what's your kind of framework for risk?
Yeah, I think I'd answer that two ways. The first is just on a personal level. And then the second is like business, military operations, et cetera. The first is like the personal risk of like I find it to be personally more risky to look back at the end of my life, or, when I'm old and gray and retired, and say, if only I had done XYZ, like if only I had taken that chance to start that company or to try and become a Navy SEAL. That to me is like a sad place I don't want to be. And so for me, it's like risk minimization, meaning like take the leap now. The real, like, I don't view it necessarily as risky to start the startup, because like if I fail, I know I'll fail on my feet, or I'll figure out a way to make something work. The risk to me is looking back later on saying like, man, I wish I had done something. And I think part of that comes from a business school professor I had, who's just like a wonderful, like old school teacher. Like I'm reminded of Robin Williams. I forget the name of the movie, but I'm reminded of Robin Williams when he's a high school professor, and like all the students just absolutely look up to him.
Oh yeah. Dead Poet Society.
Yes. Dead Poet. Just like one of those seminal professors that everyone will remember the rest of their life. And I had this gentleman who was a professor who taught this amazing class at Stanford. And I don't even remember if I mentioned this in our first conversation, but he wrote on the whiteboard. And if I did, apologies, but he wrote on the whiteboard basically as like the true mic drop moment, last day of class: regret for what you have done is tempered with time, but regret for what you haven't done is eternal. And so that stuck with me. And that was like a really powerful framework. The second way I would answer your question about like business or military risk, business and military risk, is like doing pre-mortems, we would call them. So like a post-mortem's obvious. Like what if something breaks, let's look back and see what we could learn. The concept of a pre-mortem is like, what is going to go wrong that derails this investment project, clinical trial, and let's go ahead and mitigate those ahead of time. So it's like similar to the concept of a devil's advocate, but it's like, what is going to break? And if it breaks, what goes existentially sideways? Let's fix those. So in a military operation, or a SEAL operation anyways, we look at sort of like two, I've tried to take this over to business. We look at two types of risks, like what we would call like the most likely course of action, and then the most deadly course of action. And if you can plan for both of those, then you're pretty good. I mean, the enemy always gets a vote, but like you feel like you've done a good job. So I'll just give you an example. If you're let's say you're going to go do a night raid in a village in Syria or Afghanistan, and you're in 3 different vehicles because you have 15 guys. Most likely course of action is that could derail the mission is you take some small arms fire, and I'm like simplifying this a little bit, but you take some small arms fire and you get a flat tire. Well, if each of those vehicles only holds 5 people, you now have to cram 15 guys into 10 vehicles. If one goes down, like that's a problem, because people are going to be hanging off the side of it, and that's not good. So how could we mitigate that? it's called like we have a bump plan. So we'd bring extra vehicles. Maybe you're only putting 2 or 3 guys in every vehicle. So if one of them goes down, you can just blow that vehicle up and everyone piles in the extra seats. And like, it's already rehearsed where everyone's going to go in the bump plan. Like if this vehicle goes down, Ed, you're going to vehicle 1, George is going to vehicle 2. So like you can do it in the middle of the night, split second. That's sort of the most likely course of action and how you would plan for it. The most deadly is, okay, let's say 2 of those vehicles get hit with RPGs and blow up. And then we get a complex ambush of like machine gun fire and small arms fire. That would be really bad. So how do we mitigate that? Maybe we decide to walk in the middle of the night. Maybe we say, we're not doing this mission unless we have an F-18 overhead to like drop bombs to support us. You wouldn't really arrive at those mitigants. Maybe we should walk at night. Maybe we should have aircraft. That becomes a go, no go. Meaning if we don't get the aircraft, we're not going because it's existential. If that most deadly course of action happens, then it becomes like existential to survivability and mission success. And so you could create your go, no go criteria. So like, I think if we, all that to say, like in business and in the military, if you break things into just a mental framework of like what's most likely to happen, and then what's the absolute worst case that can happen. And if I mitigate those 2 things ahead of time and plan around them, I'm probably going to be all right. Or at least the planning process will have shed some interesting insights that I can sort of at least work around or work through.
How do you know when you're done planning? Because I think particularly in business, you could get in this cycle of just really running through every single worst case scenario and get stuck almost in a planning loop. And so how do you know when you're done? Like, is it a gut instinct for you at this point?
Yeah, I'm just like cracking up internally because like the concept of like analysis or paralysis by analysis is so important. I think for me, it has become somewhat personal, like almost trust but verify. Like if our team and our managers, I'll read things or go like super deep in the weeds if we're planning something, just to like show that I'm paying attention to the details, and then kind of back out and be like, okay, if you can answer that really, really insane scenario that I just came up with, or if I'm like reading, the 20th paragraph of a contract, and if you can't answer those questions for me, then like we probably need to keep planning, and I'm not at a level of comfort before we execute something. If you can, and with our team, I have such high levels of trust, but if you can answer those things when we like sanity check it or pressure check it, then we're probably at the end of the planning process. I was chuckling when I started answering this because there's like 2 sort of sayings that I think it's like Jekyll and Hyde in the SEAL community. And one is just like the concept, like the X is what we call like the target. Like the X is where you're going, like X marks the spot. And there's just a SEAL sort of saying called like flex on the X, which is like, we'll plan, but it's like pick up basketball. Like it's literally pick up basketball. You get to the X and you just flex when you're there. Yeah. But like you can play pick up basketball and it doesn't have to be orchestrated, but you still practice plays, right? You still practice twice a week. And it's that concept. The other is the concept of like, there was, I think it was Bill O'Reilly, the old, and maybe he's still there, but Fox News host.
Oh yeah.
There's this like,
guy,
this great clip of him. And I think anyways, like we could probably talk about him or what happened, till we're blue in the face, but there was a great clip of him where he was rolling on a hot mic and didn't know it.
Oh, I've seen that.
And they're trying to rehearse. And he just goes, fuck it, we'll do it live. And he all his stuff down. And so like a lot of SEALs will wear a patch on their uniform just as a joke that says, fuck it, we'll do it live. And so like there's a little bit of that, which is tongue in cheek. But yeah, so I think it becomes a personal touch and more of a stylistic thing. Like when is planning, when's over planning. But that's how I think about it.
Yeah. I mean, that makes sense. You think about the basketball analogy, or even with Bill O'Reilly. I mean, if you put in the reps and you got the basics down, that's the whole point of practicing the basics. So when it comes time to improvise, you can improvise. But if you don't have any basics and you start trying to improvise, that's probably going to not work out too well.
Gonna work. Exactly.
When you hear about this journey you've been on, both, really since since high school, when you think about your success with the Morehead Kane and then the SEAL, Stanford Business School, this startup that's doing so great, or not a startup anymore, a really well-established, highly functioning business. And then you look at your wife, which I want to talk about in a minute, and all the success she's had. And I think somebody watching from the sidelines could be like, oh man, they got it figured out. There's something that they know that I don't know, or they're smarter than me, or, come up with a long list of reasons why y'all have been able to do it and other people may not be able to do it. But I'd love to hear if there are any, like if you have a favorite failure, whether that's in, that could be in when you're in the military or in business now, but something that didn't go as planned and a big challenge that you had to overcome, and kind of what you learned from that and how you did it. Because I think it's real easy just to, talk about the highlight reels and for people just to interpret all of this as a highlight reel. But there's no way around it with everything you've done. There've been some times where things didn't work out. Does anything come to mind as a real learning moment in that regard?
Yes. We would run out of time if not all of them. But absolutely. It's funny because like the highlight reel, as you put it, just feel like if I like from the outside looking in, look at other people or people I look up to, everything seems so like choreographed in a good way. Not like
sure,
not inauthentically choreographed, but just like everything's gone to plan. Everything's sort of linear and up and to the right, and just seems so intentional. But then you like talk to those people and it's completely all over the map, right? Like so much is to luck, so much is to hard work, but nothing is necessarily linear for them. And there's just bumps along the way. And so like, I think and I'd speak for Caroline, my wife, would feel the absolute same way. And it also like, we're so far from having it figured out just in general. For us, it's like, and we like struggle with this personally, basically every day. Like if kids go down and we have a glass of wine or we try and go on a hike or something, we're like, we have to force ourselves. And we wish we didn't have to force ourselves. We wish we could do it naturally, but we're not there yet. We have to force ourselves to like enjoy the process, meaning like our kids are never going to be 6, 4, and 2 ever again. So like, even though it's hard and we work long hours, even though we love what we love, like we sort of like beat ourselves up for not being as emotionally or mentally present with our kids as we want to be. And that could be like after a long day's work, or, like I coach the boys t-ball, and like coach standing on the t-ball field, and I'll find myself like, oh shit, I was just thinking about work. Like, why am I doing that? Like, yeah. I want to be thinking about my kids. So we are so far from having it figured out. But I think we make a conscious effort. If I like one big failure in learning for me that I can just point to, and I were thinking about the Navy, so this one kind of just popped in and came top of mind, is I remember I was a young junior officer. So if I was in the Marines or Army, I would have been Air Force first lieutenant. For the Navy, it's called a lieutenant junior grade, an O2 for anyone that's familiar with military ranks out there. But nonetheless, I'd been in Afghanistan, like leading teams. Our teams have been kicking ass. We had been there for 10 months at this time. And there was a much more senior person. And we had like this silly, I shouldn't say silly, but we had like sort of the most benign operation ever. Like that, I would never say we could do it in our sleep because that would suggest complacency. But like in terms of the risk spectrum, this one was not far out there. And we were basically going to walk like 200 meters, not far. Like we do this all the time. And I remember you put in what's called a con-op, a concept of operations, which is basically like your outline for the mission, who's going, what vehicles you're going to use, what radios you're going to have on, things of that nature. The 5 W's, like who, what, when, where, why, that sort of stuff. And we were getting ready to start this mission. And this commander from sort of like 2 bases above was like, hey, you're not walking there. I'm like, the hell we are. Like it's 200 yards away. We could hit a 7-iron or what, like it's not far. Like we're walking. He's like, nope, you're taking the vehicles. And the vehicles are like basically tanks. They're called like MRAPs. I mean, these things are huge. They're a pain in the ass. Everyone can see you coming from 10 miles away. And it like completely, I don't know if I was just at a breaking point, but it like we got into like a shouting match on the phone, which like you don't do in the military. And it was like kind of over nothing. It was like stupid. And my chief, a guy named Charlie at the time, or my chief at the time, my now friend Charlie, was like, hey, just hang up the phone and let's talk. And we put a big wad of chewing tobacco in, which is what everyone does on deployment. Sorry, Mom, but put a big wad of tobacco in and just went for a walk. And he's like, dude, you're not seeing the forest for the trees. Like you were so, and like technically I'm a higher rank than this guy, but he's been in the SEAL teams for 25 years versus me for 2 at that time. He's like, you're not seeing the forest for the trees. Like a good leader, one, knows the battles to fight. And this is not one of them. Like we have great freedom of maneuver. We enjoy a good relationship with our commanders. They let us do what they want. And like, truth be told, we have like a month left in deployment. Is it really worth, like, what if someone gets hurt? It's time. Like we need to be extra risk averse or extra protective right now. And he's basically like, you're so wrapped around the axle with your day to day. You're not thinking a month down the road, 3 months down the road, 6 months down the road. He's like, pull your head out of your ass. Start thinking like a big boy instead of like you got your feelings hurt because someone told you to change your plan. And he's like, this has nothing to do with whether you're walking or driving. He's like, it has to do with you feel like your authority is being stepped on.
Yep.
And you are reacting defensively. You're not thinking appropriately. You're reacting defensively. And I was like, Jesus Christ, you're right. Like, holy shit. You just like like a 35-year-old man psychoanalyzing a 24-year-old boy at that point. And I was like, wow, I really sort of understood in that moment, like how noticing one's emotions and reflections basically can like change the outcome of a situation, but also just how we like outwardly project. Like I was not mad at him, at my commander. I didn't give 2 shits about walking or driving. Who cares? It was just like, that's how I reacted to having what I thought was my authority questioned or trounced. And that was a really important lesson for me as a business person, thinking like, you know, if an investor asks a question or a partner asks a really probing question, or just says like, hey, I think this is a dumb idea, to sort of sit back and meditate on what I'm feeling or how I'm reacting in that moment. And I still have to force myself to do that every day. Like I'm so far away from being sort of as spiritual and nirvana as I want to be in the noticing and harnessing of emotions. But for me, that was a big failure of myself as a leader, to not have the ability to notice like what I was feeling and how it was driving my reactions.
I love that. That's one of the things I love when I read and listen to so many podcasts about, you know, that involve Navy SEALs, and that this commitment to being calm is, I think that is because I used to think that I had this idea like the tough guys are the ones that are, you know, up in your face and acting like tough. And what you learn by studying guys like you is that calmness is kind of the ultimate confidence. And that brings me to another question. It's very random, but I wanted to ask you.
Please.
It's kind of a rhetorical question. I hope it is. But you know, you've operated at these elite levels all the way, and you're the most humble, chill, calm, nice guy. And then across the board on this podcast, I mean, whether I've had NFL Pro Bowlers on here, calm, chill, humble, Pulitzer Prize winners, humble. And one of my least favorite characteristic a person can have is arrogance. And so I'm just curious, is there any role for cocky arrogance? I don't, you know, I'm not talking about confidence, but have you ever, in all your experiences, have you ever seen that there's a role or justification for somebody being like a cocky asshole? Because I can't see it, and I very well may be missing it.
I appreciate you saying that about me, and I feel like I have so much to learn in that regard. But if there is a role for a cocky, arrogant SOB, I have not figured it out.
Okay.
At all. Yeah. I mean, I'm reminded of like, you know, a SEAL chief. I had actually a SEAL senior chief who came on a mission one time and basically was like with us, his more junior team, and basically was like, I'm probably not even going to pick my gun up during this mission or firefight, and would like literally walk around with a clipboard, like as the bullets are flying.
Really?
Yeah. Like he'd carry a clipboard. I mean, obviously he had his gun and was very ready to use it.
Sure.
But he's like, what what's one more gun going to have here? He's like, I need to demonstrate calmness and confidence in my guys. And in real time, I'm going to take notes so that we can actually do a really good debrief here. He's like, that's what I need to do. That's my job as a leader. And I was like, wow, seeing senior chief have like a clipboard, literally a clipboard, not his gun up. I'm like, that inspires confidence, but very humble person that easily could have like said, hey, I'm the first one through the door. I'm going to do this. Everybody stack on me, that sort of stuff. Nope. He was like, I'll let the younger guys have all the fun. I'm just going to figure out how to watch in real time what everyone's doing, and I'm going to debrief it. And like, that takes a level of humility and confidence that I love and inspires me. I don't know of any, cocky sort of the asshole types. I don't know.
Okay. Well, I was hoping I put that big lead up in the question. I was like, what if he disagrees? But that's why I asked, because there very well may be. I don't know, but I just can't. The more I learn and the more confident I actually get in my own way of doing things, the less tolerance I have for that kind of behavior. It just strikes me as like the ultimate in not having confidence when you act like that. So anyway, glad to get that confirmed. We got to talk about your wife, because I think last time we recorded this, she had obviously already had a great career, but she really was, I think as the pandemic came down, she ramped up and readjusted her business model. And it is unbelievable to see the success she's had. And she's made me a hero in my family, because now I'm like a master chef.
Amazing.
Tell me your thoughts on her. And then I'd love to know just your thoughts on that whole trajectory and how awesome it's been. And then I'd love to know what you've learned, whether in business, whether in leadership, whether in just overall attitude, what you've learned by observing her journey, because she's an all-star, obviously, and she's one of the funniest people I've ever seen. I've never met her. I've just seen her stuff, and she's awesome, man.
Well, I appreciate that. And I know she would too. So my wife, Caroline.
But everybody thinks that. I'm like one of a million people like chirping that. Like she's just really has built this unbelievable following. And I think everybody who follows her feels like they're her best friend, and
the irony is, and I think this is why it's contributed to like why people like to follow her and listen to what she has to say, is she is like, what you see is what you get. Like, that's the Caroline I've been married to for 12 years and have been together with for 15. And I think it's like crazy to me that it's a novelty that people sort of, their personalities aren't themselves. If it's like authors or people that in any way, shape or form are in the public eye, that they have this sort of mask up. I get why they do, but for Caroline, it's like so authentic. It's what you see is what you get. And I think that is part of her appeal, and certainly like why I fell in love with her 15 years ago. But, so she, at the beginning of COVID, she had written one cookbook, and it was success. It was definitely successful, and she liked it. She wanted to go write another one. And, this was 2020, and basically every publishing house told her like, hey, you have to have a social media following, because for them, it makes sense. Like, they don't want just, and I don't mean a nobody, but in their mind, a nobody like launching a cookbook, and there's no built-in audience. There's no built-in distribution platform. So they're like, sorry, you don't have an Instagram following. So like, you're never going to get a cookbook deal. So she was kind of like, okay, I guess I've got to get an Instagram following. And she did that. And again, they're like, you've only got 5,000 followers, which is basically like every friend of a friend. And, my friend's aunts and uncles and that sort of thing. And they're like, Stan, that's not enough. You got to get more. And she was like, well, screw you. I'll just do it myself. So she ended up writing a food and drink Substack news article or newsletter. And it just absolutely took off because of her hard work and fortunate timing. And then sort of fast forward, that thing has blown up in a good way. And then because of that, she's been able to partner on this latest book, What to Cook When You Don't Feel Like Cooking. And it's again taken off, and she's been on the New York Times bestseller list, I think 9 weeks, which doesn't really happen with cookbooks. And like,
that is so awesome, man.
It's awesome. I'm so happy for her and proud of her. And she's like so fired up on it. It's like, it's why you asked what I had learned about it or about from her. And I think like the two things that she epitomizes, it's like the Nike slogan, just do it. Like she literally was like, literally just do it. Like I'm going to build an Instagram following. I'm going to write another cookbook. I'm going to get on the New York Times bestseller. And there's like, we were talking about planning. She's like the exact opposite of me. I'm like
really
logistics planner. Like literally I feel bad. I was like, I just picked up my phone. I'm glad we're not on video, but I was like, I just texted her. I'm like, Caroline, there's a storm coming. Like I'm like, get your car gassed up in case the power goes down over the next like 3 days. And she's like, oh, I didn't even know there was a storm coming. I think my car's at the gym. And I'm like, how the hell do you not know where your fucking car? Like, it's like, that is us in a nutshell. And like, that is so us, but she just did it. She's like, I'm just going to do it. I don't need a plan. I'm just literally going to start living this thing. And then the other thing I would say in terms of what I've like learned, that I've learned from her is she is exceptional at like I was mentioning, sort of being present with my kids. It's something I'm not great at and that I'm working on. She is exceptional, and I'm so jealous of it, at the ability to like stay present with whatever she's doing. And I think it makes her an awesome wife and mom and professional, everything else. Like if she's there with you, like she's there with you. And I'm envious of that skill, and I appreciate that about her, that like I can be talking to someone for better or for worse, and like, a work thought will pop in my head, or I'm like, oh, I got to go, what do I got to get at the grocery store on the way home or something like that. And she is like 100% focused on you, if you're with her at that moment.
Well, dude, it's been so inspiring watching her and her journey. I mean, I've learned a lot, with what I'm trying to do with all my stuff, and watching her, and I think the lesson for me from watching her is just that commitment to authenticity. Just like, it might not be for everybody, but this is what it is. And I think people are really drawn to authentic people. And you can tell over time, you can tell if somebody's putting on a show or not. And anyway, it's just been awesome. All right. I got two more questions for you.
Yeah, man, fire away. This is
the first one's about books. I'm always looking for book recommendations. I remember in our first conversation, you had some good ones, but I read, and I don't even know if there's a full connection here, but I know your son's name is Mattis, or one of your son's name is Mattis. Yes. And I read Jim Mattis's memoir, and it's one of the best memoirs I've ever read. And I think knowing that your son was named that is what kind of encouraged me to read it. And what an absolute badass servant leader. And so that's a book I read because of you indirectly. Oh, and is Mattis, is General Mattis a big, does he play a role in your life?
Yes and no. Yes, in that I chose to name my first son after him, and we do have a relationship, and the two of them have met, like my little Mattis and big General Mattis. And it was like a very, very special day. So he both directly and sort of indirectly plays a role. Is he there daily, like babysitting my kids? Absolutely not. I would never pretend to be that close to him, but like, he plays a very inspirational role.
That is awesome. Anyway, it's not about my book recommendations, but because of you, that was one of the more important books I've read in the last few years. So thank you for that. Indirectly. Any books you've read recently that have kind of struck a chord?
It's so funny. We were just talking about Hampton Sides before we went on. And Caroline got me his book, Blood and Thunder. I haven't started it yet. It's on the bedside table, but I'm so fired up to read that book. I can't wait.
You'll love it, man. It's one of the best. It ignited my passion for history. Like I point to that book.
It's so, I love the way he writes. It's really neat. So, the one that and this is like kind of an old school one, but King Rat. I don't know if you've ever read that. It's by the same author as, the TV series Shogun.
Yeah.
The book behind Shogun is like 1,300 pages long. And it's really good, but it's a serious undertaking. But he wrote another book, James Clavell is his name. He wrote another book called King Rat. And I'm like 3/4 of the way through that. And it's about a prisoner of war camp in World War II. It's a novel. So, and it's not dark, but it's historical fiction, and it's really good. And I'm loving that one. King Rat. The most recent like history book I've read, which I thought was awesome, or nonfiction, was a book called Splendid in the Vial. Have you heard of that?
I've got it, but I haven't read it about Churchill.
You're going to love it.
I've got it on my shelf.
It's a really good one. I finished that probably a month ago, and it is kick ass. Like it was kind of like someone gave it to me, and I'm like, man, the last thing the world needs is another Churchill book.
Sure.
But I misspoke. That book is awesome. It's so good. And like just the character development, all the people around Churchill, it really takes you into like the personal. I feel like there's so much that's been written or, made in film about like the planning of D-Day and the execution of D-Day and what World War II was like. But the actual personalities and like, where did they go to dinner? What were they doing when the Blitz happened? Like, who were they dating? How was, Churchill had kids. Like, was he a dad? Like, he would bring his kids along to like their country home and they'd be meeting with world leaders and a bomb would go. Just like he really personalizes Churchill in World War II. And that was something that I had never been exposed to. And I thought it was wonderful.
Well, I've been sitting there forever and I haven't read it and I've heard great things. And that's what Hampton Size does as well. Like, it's almost like he has a bunch of mini biographies within his history. And so you learn about all these characters. And then when you finish, you're like, oh, now I know everything about the American Southwest. But you're going to love Blood and Thunder. Those are great. All right. Last question for you. And seriously, man, like we could do this. I'm not going to ask you or bother you, but like we could do this like twice a year and I still wouldn't even come close to getting through all my questions. This is so much fun. And I learned so much. Last question for you. Did I miss anything? Any parting words of wisdom? You've given so much during this time, but anything you'd like to say to kind of wrap it up?
Thank you for everything and for listening to me and being interested in my story. I'd flip the question if I can and say like, all right, if you could look, you and Kim could look back 10 years ago when your kids were younger, when they were my kids' age, 6 and 4 and 2, what would you have done differently as a professional, as a dad, as a husband, whatever that is? Like, what can I go to school off of that you did or didn't do?
Oh, dude, that's a good one. And interestingly, I'm not, even though my hair is turning white and I feel like more of an old man every day, like my back was hurting this morning, I'm not that far ahead of you with the kid stuff. So I've got an almost 10-year-old and almost 7-year-old. So I'm like just enough ahead of you. For me, I mean, you're already doing it. It's just, I get a lot of really deep pleasure and joy and satisfaction from it's putting them first. Like for, for even when I don't necessarily want to do something, like we were skiing this weekend. I don't really care about skiing in a resort at all. I mean, like it's fun, whatever, but I know that those girls they love it. And so like, it's been nice for me, almost like being of service to them in a million ways. And skiing's kind of a silly example, but it's like, I want them to have these wonderful memories of doing this. I want them to learn how to ski. I want them to be Colorado girls. And so like putting aside any like silly opinions I have about things that maybe kind of don't really matter in the long run. Like I don't particularly like skiing, but like putting them first, which is a pretty simple answer, I would say, and pretty, it makes sense, but yeah, it is. And it's just like, I've found to get a lot more real deep contentment by not being about me. Like I'm the last person in the pecking order. The last person I care about is me, it's the kids, is Kim, and just having that service mentality, which I think, you've obviously had a lot longer than I have, but that there's something a lot more important than me, and embracing that. I think I could think about that and probably write a whole book about it though. That's a great question. You can start up a podcast on top of everything else you're doing.
Yeah, maybe you should do that. I'd read it. Well, thank you, man. That's a very good reminder to everyone, but especially to me. So thank you.
Well, thank you, man. You get back to work. You got a lot of stuff going on. Give your wife our best and our appreciation for her amazing work. But seriously, man, I got so much great feedback after our last conversation. So I'm going to be excited to get this one out in the world, and I hope we can stay in touch. And it's crazy we haven't met in person.
I know.
But we will one of these days. But
we will.
I really appreciate everything you're doing.
Thank you. I appreciate that.
Hey, it's Ed again. Thanks so much for listening to the podcast. I know your time is valuable, so it means the world that you spend it listening. If you want to support the podcast and help it to continue to spread and grow, there are a few ways you can help. Number one, pass it along to a friend or share it on social media. Word of mouth recommendations are the most powerful way for ideas to spread, so I'd love it if you could share the podcast with a few pals who might enjoy it. Number two, you can go to Apple Podcasts and give it a 5-star review. Good reviews encourage the Apple overlords to suggest the podcast to others. So there's a link in the notes if you'd be so kind as to give it 5 stars. Number three, you can support the podcast financially via Patreon, and there are exclusive benefits for those who do, including a monthly behind-the-scenes newsletter, Mountain and Prairie stickers, live and recorded video chats with podcast guests, and much more. Number four, I've also got 2 emails that I send out. The first is my weekly email called Good News from the American West, which I send out every Wednesday. It's only positive news, something we can all use a little more of these days. And my other email is my bi-monthly book recommendations email. One email every other month with 5, 6, 7, or 8 books that I've recently read and highly recommend. The thousands of people on both of these lists will vouch for me. No spam or other funny business. And number 5, finally, check out my online store for Mountain and Prairie stickers, shirts, and coffee mugs. I've got some really cool designs from Western artists with more on the way. So head to mountainandprairie.com/shop to check it all out. I'd love to connect with you. I'm on Instagram and LinkedIn, so look me up on either of those platforms by my name or through the links on my website. All right, that's it. Thanks so much for your support.